week after California legalised assisted suicide in 2016, Stephanie Packer, who was fighting terminal cancer, received a disturbing letter from her health insurance company. Stephanie was told the chemotherapy treatment the insurance company had previously promised was now being denied. However, she was later informed that her plan would cover the cost of pills for assisted suicide, which would come to just $1.20. Barbara Wagner in Oregon was seeking chemotherapy treatment to fight her advanced lung cancer. The Oregon Health Plan Office refused to pay $4,000 per month for her treatment, but it did offer to pay $50 for lethal prescription drugs to end her life by assisted suicide. Wagner told the local newspaper, "To say to someone, we'll pay for you to die, but not pay for you to live, it's cruel."
They would pay to kill me, but they will not give me the medication to try to stop the growth of my cancer.
And now, research is being published in peer-reviewed journals which calculates the cost savings to healthcare spending if people die by assisted suicide instead of receiving medical care. Hundreds of millions in costs can be saved, say those setting healthcare budgets. While campaigners insist this is about choice, in reality, insurance companies, budget committees, policymakers and others are looking at assisted suicide in a totally different way. For them, it's all about the money. Medical care is expensive. Drugs used in assisted suicide are cheap. That's the horrible reality that's driving some of the thinking around this issue. The cases that have come to light are very, very concerning. Stephanie Packer said that the reality of how insurers were thinking really hit her in the gut. The most cost-effective solution was now assisted suicide, she told Columbia magazine, and there are many such cases. Dr. Brian Callister, a physician practicing in Nevada, spoke about the danger for people who were sick and vulnerable. "I had 2 patients recently in Nevada on my service who both needed life-saving procedures. Not palliative care, not hospice. These would have been curative procedures," he said. One patient was from California, which has passed assisted suicide, and one patient was from Oregon, which has had it for 20 years. In both cases, when I was explaining the need for transfer for a life-saving treatment to the insurance medical director in both of those states, assisted suicide was offered up instead.
They told me flat out, "Brian, we're not going to pay for the life-saving procedure. But oh, by the way, have you considered assisted suicide?"
He says the disabled, the depressed, the poor and the marginalised are being forced down this road because they're going to be denied treatment by insurance companies. In 2018, Roger Foley from Ontario, who suffers from an incurable neurological disease, made audio recordings of hospital staff offering him medically assisted death, although he had repeatedly asked for assistance to live at home. He was told he would be charged $1,500 a day if he continued to take up a bed in the hospital. Roger Foley is Canadian, and the number of people being killed by assisted suicide has increased 5-fold in 4 years since it was legalised in 2015. A medical paper published in a leading Canadian medical journal claimed that millions could be saved in reduced healthcare spending by medical assistance in dying. It could result in substantial savings, the paper noted approvingly. The paper was entitled Cost Analysis of Medical Assistance in Dying in Canada and was published in the Canadian Medical Association Journal. It noted, "If Canadians adopt medical assistance in dying in a manner and extent similar to those of the Netherlands and Belgium, we can expect a reduction in healthcare spending in the range of tens of millions of dollars per year." A report from the Parliamentary Budget Office in Ottawa suggested that expanding access to assisted suicide would lead to nearly 1,200 more such deaths next year, and that this would be a saving of $149 million on end-of-life care spend. Everyone, especially those who are older or with a disability, should be entitled to the medical care they need. Instead, laws on assisted suicide and the hidden agendas of insurers and other agents are now often making the most vulnerable feel as if they are a burden, who should end their own lives with the help of a doctor. This is the cold, clinical reason behind some of the push for assisted suicide and euthanasia. It's all about the money, and it needs to stop.